Have you ever seen an animal do something that, well, it looks really familiar, like something a person might do, but then you look closer and you realize, nope, this is something totally different and kind of mysterious.
Definitely happens.
Yeah, like imagine watching a horse and you think, oh, it's got hiccups, but then it's just not quite right. It feels more, I don't know, precise, peculiar.
Exactly. That's a perfect lead-in.
Because today we're taking a deep dive into exactly that kind of thing, an intriguing condition in horses called Synchronized Diaphragmatic Flutter, SDF.
Right. Or, as most people probably know it.
Thumps, yeah.
Yeah.
Or sometimes equine hiccups, though we'll see. That's maybe not the best term.
Probably not.
Mm.
But thumps definitely captures the sound sometimes. This is, it's a really fascinating look at physiology and chemistry kind of meeting.
Right.
It's a pretty remarkable example of what happens when that delicate internal balance in a horse just goes slightly off. And what that tells us about how interconnected everything is inside them.
Okay, so our mission today then is to unpack the research, the findings on SDF, give you, the listener, a clear, sort of concise understanding.
Yep.
What it is, why it happens.
How to spot it, and maybe what it tells us about, the bigger picture of biological balance. Think of it as your shortcut to getting up to speed on equine thumps without wading through super dense stuff.
Exactly. Let's break it down.
Okay, so let's start right there. What does thumps actually look like or sound like if you're, watching a horse?
Well, the name thumps is pretty descriptive sometimes. What you're seeing is this rhythmic contraction. It's the diaphragm, that big muscle separating the chest and the abdomen.
Okay.
Contracting. But the absolute key thing, and this is what makes it so distinct, is that the contraction is perfectly synchronized with the horse's heartbeat.
Ah, not its breathing.
Not his breathing cycle at all. Completely different rhythm.
So it's a heart thing driving a breathing muscle.
Oh,
That's
man.
wild. It is. And the most obvious sign, the thing you'd notice, is this sort of spasmodic movement, sometimes quite noticeable, like a flapping or thumping in the flank area.
The flank being, where exactly?
Right in that sort of softer abdominal area just behind the last rib, you'll see this twitch, this contraction, happening in perfect time with the pulse.
Okay.
And yeah, if those contractions are strong, you can actually hear a thump. That's where the name comes from.
That's fascinating. How does that even happen? An electrical signal from the heart making a muscle contract somewhere else. It seems like wires getting crossed.
It kind of is, in a way. So the diaphragm, the main breathing muscle, it's controlled by the phrenic nerve.
Right.
And anatomically, this nerve has a really unique path. It runs right over part of the heart, specifically the right atrium.
Oh, wow. Okay.
Now, in horses that develop SDF, this phrenic nerve becomes what we call hyperexcitable. It's overly sensitive, basically.
Like it's on edge.
Exactly. And because it's sitting right there, so close to the heart, the electrical impulse from atrial depolarization, that's the very first spark of the heartbeat, the heart's own electrical signal kicking things off, that electrical signal can accidentally stimulate this super sensitive phrenic nerve.
So the nerve just picks up the heart signal.
It does. And boom, the diaphragm contracts, perfectly in sync with that heartbeat, which explains that really precise rhythm you see. It's this amazing or maybe problematic interplay between the nervous system, the cardiac system, and the muscular system.
That is incredible. The nerve is practically sitting on the heart, just waiting for a signal it shouldn't be listening to. But, okay, the big question then, why? What makes that nerve get so sensitive? It's not just random, right?
No, definitely not random. You've hit the core issue. SDF, this thumps, it's almost always a clinical sign. It points to underlying, usually severe, electrolyte and acid-base imbalances in the horse's body.
Okay, electrolytes, like salt.
Well, more specific than just salt. We're talking about deficiencies in key ions. Low blood calcium, which is hypocalcemia, that's a big one, often coupled with low magnesium, hypomagnesemia, and low potassium, hypokalemia, and low chloride, hypochloremia.
Wow, okay, so a whole cocktail of things missing.
Exactly, and it connects right back to that nerve sensitivity. These ions, these electrolytes, they're absolutely critical for how nerves fire, how muscles contract. That delicate balance is essential.
And I think I read somewhere, sometimes even if the horse has enough calcium in its blood overall, it might not be the right kind of calcium.
Right.
Or it's not available. How does that work?
That's a really crucial point. It gets into something called alkalosis. That's when the blood becomes too alkaline, either because of respiratory issues or metabolic ones.
Okay, too alkaline.
Right. And this state, this alkalosis, it actually makes the problem worse. What happens is more calcium and magnesium start binding to a protein in the blood called albumin.
Binding, like sticking to it.
Exactly. They get stuck to the albumin. And when they're bound like that, they're not free. They're not available for the body to use, especially for nerve function. So this leads to a decrease in ionized calcium and magnesium. That's the free, active form that nerves really need for their electrical signaling. So you can run a blood test, and the total calcium might look okay, maybe borderline.
Right, looks fine on paper.
But the ionized level, the stuff that actually matters for nerve excitability in this context, could be dangerously low.
Wow. So the body's own chemistry can kind of hide the real problem. That's tricky.
It really is. Alkalosis makes the hypocalcemia and hypomagnesemia functionally worse.
Okay, so what kind of situations usually cause these big electrolyte swings in horses? What triggers this whole cascade?
Well, the research is pretty clear that the most common trigger by far is prolonged, intense exercise.
Performance horses.
Exactly. Think endurance horses covering huge distances, thoroughbreds, standard-bred race horses, especially when they're working really hard in hot, humid weather.
Makes sense. Sweating like crazy.
Just pouring out sweat, which means massive fluid loss, and along with the fluid, massive electrolyte loss. Dehydration and depletion, setting the stage for SDF.
Okay, so hard work is number one, but you mentioned surprising triggers too.
Yeah, there's some others that are less common, but definitely important. One is blister beetle toxicosis.
Wait, blister beetles? Like bugs?
Exactly. These little beetles contain a potent toxin called cantharidin. Sometimes they get accidentally harvested along with alfalfa hay.
Oh, no.
Yeah. So if a horse eats hay that's contaminated with enough of these beetles, the toxin can cause all sorts of problems, including really severe gut irritation and, importantly for us, major electrolyte disturbances that can trigger SDF.
Blister beetles in the hay causing thumps. Okay, that's definitely not the first thing I would have thought of.
Not at all. Other things. Severe gastrointestinal disease like bad colitis or sepsis, those can really throw fluid and electrolyte balance way off.
Makes sense if the gut isn't working right.
Right. Another one is lactation tetany or milk fever. You see this sometimes in mares that are heavily pregnant or producing a lot of milk. They just deplete their calcium reserves massively.
Like a full.
Exactly. Other factors, maybe less common. Overuse of diuretics, stress from transportation, sometimes trauma. Though it can affect any horse, really any breed, age, or sex, it does seem to be pretty rare in really young foals.
Okay, so we have a good idea of what it looks like. The thumping, the flank twitching synced to the heart. And we know why it happens, these deep electrolyte imbalances, often triggered by exertion or sometimes these other weird causes like blister beetles. If you're a horse owner or a vet, how do you confirm it's actually SDF and not just, I don't know, muscle spasm?
Yeah, good question. The diagnosis starts clinically, meaning it's largely based on observation. Seeing that characteristic flank movement, that thumping, and noticing its rhythm.
Matching the heart.
Matching the heart perfectly. A vet can confirm that synchronicity really easily. They'll listen to the horse's heart with a stethoscope.
Auscultation, right.
Right, auscultation. And at the same time, they'll watch, or maybe even gently feel that flank area, palpate it, to confirm the timing. Heartbeat thump. Heartbeat thump.
Okay, so the observation is key. But I guess to really know what's going on underneath, you need tests. Blood tests.
Oh, absolutely crucial. Blood analysis is where you get the real evidence. Vets will check hydration status, look closely at those electrolyte levels, the calcium, potassium, magnesium, chloride are the big ones, and they'll assess the acid-base balance, looking for that alkalosis we talked about, metabolic or respiratory.
And this brings us back to the ionized levels, right? Why are they so much better?
Because, like we discussed, ionized calcium and magnesium levels tell you what's actually free and biologically active in the bloodstream at that moment. Total levels include the calcium and magnesium that's bound to proteins like albumin, which isn't immediately usable by the nerves. So ionized gives a much more accurate picture of the functional deficiency causing the nerve hyperexcitability.
Got it. So ask for ionized levels if you suspect thumps.
Definitely. Blood gas analysis is also really helpful for pinpointing the exact acid-base status. And in, more complex or research settings, they might even do more advanced things like simultaneously recording an ECG, the heart's electrical activity, and the diaphragm contractions using things like electromyography or phonocardiography. But usually, the clinical signs plus the blood work tell the story.
Okay. And what about things it isn't? What might look a bit like thumps but is actually something else?
Good point. Differential diagnosis. Well, true SDF is unique because of that perfect synchronicity with the heart. So, regular hiccups in horses, which can happen, or other sort of random non-synchronous diaphragm twitches, they won't have that link to the heartbeat.
Okay.
Also, sometimes a horse with really severe respiratory disease might use its abdominal muscles forcefully to breathe. You might see contractions in the flank area.
But that would be with breathing, right?
Exactly. Those contractions are linked to expiration, the horse pushing air out, not the heartbeat. And of course, a horse like that would have other obvious signs of breathing problems, like flared nostrils, maybe coughing, difficulty breathing. It looks very different overall.
Right, the whole picture would be different. Okay, so we've identified it. We know the likely cause is this electrolyte mess. How do you actually treat a horse with thumps? Does just giving them electrolytes fix it quickly, or is it more complicated?
It can be pretty straightforward, but you have to be smart about it. The immediate goal is correcting those underlying problems.
Right.
The fluid deficits, the electrolyte imbalances, and the acid-based disturbances.
So first things first?
Rest. Stop all exercise immediately and get fluids into them. Fresh water available is essential. For really mild cases, just resting and maybe giving some oral electrolytes might be enough. Things might resolve on their own.
But for more severe cases?
Then you're looking at intravenous IV fluids. Balanced electrolyte solutions given directly into the vein are often necessary to correct things more quickly and effectively.
And targeting the specific missing bits.
Precisely. If blood work confirms significant hypocalcemia, low calcium, then IV calcium gluconate is the treatment, usually a 23% solution.
Yeah.
And often, you'll see the thumps resolve quite rapidly once the calcium levels start to come up.
That's good news.
It is. In really severe cases, if the horse has other signs of low calcium, like muscle twitching or being overly excitable, the vet might need to administer that calcium gluconate fairly quickly. If magnesium or potassium are also low, those need replacing too, usually with IV magnesium sulfate or potassium chloride, guided by the lab results.
Okay.
And giving just plain saline solution, 0.9% sodium chloride Phe, can actually help correct metabolic alkalosis and also helps with low potassium sometimes.
Is there anything you should not give?
Yes, critically important.
Oh.
Avoid giving alkalinizing solutions, things like sodium bicarbonate.
Why is that? Sounds like it might help the alkalosis.
It sounds logical, but it actually makes the thumps worse, because making the blood more alkaline encourages even more calcium and magnesium to bind to albumin, further reducing the free ionized levels that the nerves need. So bicarbonate is a definite no-no here.
Wow. Okay. Good to know. And I assume you're monitoring the horse closely through all this.
Constantly. You have to keep checking electrolytes, acid-base status, and watching the clinical signs, the thumping itself, to make sure the treatment is working and adjust as needed.
Makes sense. It's all about restoring that balance. So looking ahead, how do you prevent this, especially in those hardworking performance horses?
Prevention is definitely key for them. If you know a horse is going into a situation where it's likely to sweat a lot, like a long endurance ride, a race in the heat proactive electrolyte supplementation is crucial.
Before, during, and after.
Yes, exactly. Before, during, and after the anticipated sweat loss. That helps replace what's being lost in real time. And hydration is paramount. Constant access to fresh water, always. Electrolytes can also help stimulate thirst, which is beneficial.
Any dietary tweaks? You mentioned alfalfa earlier.
Right. There's some thought that horses on very high calcium diets, like straight alfalfa, might ironically be a bit more susceptible during intense exertion. The idea is their body gets a bit lazy about mobilizing its own calcium stores from bone.
Ah.
So one strategy sometimes used is to reduce the amount of alfalfa for a few days before a big event. This might kind of wake up the horse's natural calcium-regulating hormones, like parathyroid hormone, making them better prepared to pull calcium from bone when needed during exercise.
Interesting. So reducing calcium intake short-term can actually help prevent a low calcium problem during exercise. Why shouldn't you just give calcium supplements all the time then? It seems easier.
It seems easier, but it's generally not recommended. Chronic, long-term calcium supplementation can actually suppress that parathyroid hormone we just mentioned. It basically tells the body, hey, we've got plenty of calcium coming in, no need to be ready to pull it from the bones.
So it dampens the natural system.
Exactly. It impairs the horse's ability to mobilize its own calcium reserves effectively when faced with a sudden demand, like heavy sweating. So you can inadvertently make them more susceptible to problems like SDF during exertion.
Got it. So targeted supplementation around exercise, yes. Chronic daily supplementing, probably not.
That's the general consensus. And finally, good conditioning is vital. A well-structured training program that gradually increases the intensity helps the horse's body adapt physiologically to exertion, making it more efficient and less prone to massive electrolyte shifts.
Okay. What if this isn't caught or treated effectively? Are there serious complications?
There can be. If those electrolyte abnormalities aren't corrected, you can see issues like ileus, where the gut motility slows down or stops, which is a serious condition.
Yeah, colic-like signs.
Potentially, yes.
Yeah.
Also, generalized muscle weakness and potentially even cardiac arrhythmias, irregular heartbeats, because electrolytes are so critical for heart function too.
But overall, the outlook is usually good.
Generally, yes, the prognosis for SDF itself is very good.
Hmm.
It's usually not life-threatening on its own. It's often transient, meaning it comes and goes, and it typically resolves either spontaneously as the horse recovers or with appropriate treatment of that underlying electrolyte imbalance.
That's reassuring.
The main exception, though it's rare, is if the underlying cause is something like primary hypoparathyroidism,
Hmm.
where the parathyroid gland itself isn't working properly. In those cases, the SDF might last for days and can be recurrent, and the prognosis is more guarded. But for the typical exercise-induced cases, it resolves well.
Okay, so we've really unpacked thumps today. It's this amazing window into just how sensitive the body's internal chemistry is, isn't it?
It really is. A physical sign like a twitching flank muscle directly points to these complex biochemical imbalances happening deep inside.
Yeah, SDF in horses is just such a clear, almost dramatic example of how fundamental that electrolyte balance is for nerves and muscles to work correctly.
Mhm. Even shifts that might seem small on paper can have these really pronounced physical effects. It highlights the incredible precision needed for everything to run smoothly and how interconnected all these systems, nervous, cardiac, muscular, endocrine, truly are.
So maybe the provocative thought to leave everyone with is this. Think about how this deep dive into something seemingly specific, like horse thumps, really shows a bigger principle. Every simple physical sign we see in any living creature probably has a complex story of internal balance or maybe imbalance behind it.
Right.
What other simple things that we observe might actually be signals of really deep, intricate biological processes that maybe we just haven't fully decoded yet? Something to think about.